Iya, ya. Assalamualaikum warahmatullahi wabarakatuh. Good morning. Thank you in advance for being giving the opportunity to present our research result at this conference. Before continue into our discussion, I will introduce our team. First, myself, Tengku Imam Syarifuddin, student at Master of Governance and Administration Affairs, Muhammadiyah University of Yogyakarta, and second author is Mr. Budiman, lecturer in Department of Governmental Science, Mula Warman University, Samarinda, S. Borneo. The last is Ms. Titin Purwaningsi, lecturer at the Master of Government and Administration Affairs, Muhammadiyah University of Yogyakarta. Our research title is Regional Health Communication, Pattern on Social Media in Handling the COVID-19 Pandemic. The coronavirus spread throughout the world and has been declared a pandemic. The coronavirus has also made the world situation critical, including Indonesia. The first case in Indonesia was confirmed on 2nd of March 2020, and it grew rapidly in 1 month to reach 1790 cases and 170 of them is died. The Indonesia government respond to this implementation large-scale social restriction, or in bahasa is pembatasan sosial berskala besar or PSBB, and zoning of regional zones. Even though in a pandemic crisis situation, the government still has to communicate regarding the situation in the field. Social media can be used as means of communication between the government and society. Therefore, the government has great opportunity to maximize the resource owned by social media in order to involve the community in making policy. Making policy for handling the coronavirus pandemic. Based on the phenomena, this paper seeks to explore the use of social media by regional heads in communicating with the public in pandemic condition, including the governor of DKI Jakarta, Mr. Anies Baswedan, governor of East Java, Ms. Kofifa Indah Parawansa, Governor Central Java, Mr. Ganjar Pranowo, and Governor West Java is Mr. Ridwan Kamil. The method in the research, this research is a qualitative research using literature study and Twitter social analysis using NVivo 12 plus software. Primary data is obtained from the personal account of the 4 regional heads. Besides, the author also used data from covid19.go.id as complementary data in this study. Stake in research is first, sorry, first is access the personal Twitter account for regional head. Second, capture data using and capture tools. And the third, import data into in Vivo 12 Plus software. And the fourth, manually coding the content of each account based on our understanding, which is tailored to the characteristic and theory use. And the last, process the coding that data using the cross-tab query feature. The next is basic theory. We are use the theory from Tina Nabati. In the her research is putting the public back in public value research, design participation to identify and respond to values. In her research, offers several communication models that can be used by the government as the alternative means of communication, namely one-way communication, two-way communication, and deliberative communication mode. One-way communication is the unidirectional flow of information of the transmission of fixed information from the sender to receiver. However, one-way communication doesn't allow for further communication because communication is only limited to gathering information. In, in addition, two-way communication is a two-way contact or flow of information exchange in which individual function as sender and receiver. Further, a deliberative communication mode in which many individuals enter into an open dialogue of the decision-making process, allowing the strength and the disadvantage of possible solution to problems to evaluate. This mode aims to make decisions based on belief, feelings, and other technical factors, not based on fact and evidence. Furthermore, uh, in International Public Participation Association offer 5 continuum framework for public participation, which is a typology sometimes used to describe joint decision-making authority. Mechanisms that inform the public are the first step, the continuum, or provide the public with accurate and reliable knowledge to help them understand challenge, option, opportunity, and solution. The next level of the continuum framework is a consult, pro, consult pro, process. Consult process is to listen to process is to listen to and recognize concern and aspiration of provide feedback about how decisions are influenced by public input. They can use one-way or two-way communication and provide minimum collective decision-making authority, if any. That at the threat level, there are processes that influence the public or work directly with the public throughout the process to ensure understanding and consistent. Ensure understanding and consistent consideration of public concern and aspiration. The engagement process usually influences two-way communication, although some many use deliberative communication. At the fourth level is the process of collaboration with the public or partnership with the public in the all aspect of decision, including the development of the alternative and identification of the preferred solution. Collaborative process are more likely to use a deliberative communication. Talk two-way communication can be used some case at the fifth level. There is a process that empowers the public or put the final decision in the hand of the public. The empowerment process most likely use deliberative communication and has the highest level joint decision-making authority because the promise made is what public decision will be implemented by the government. Furthermore, in the finding section, the author presents the data that has been compiled from covid19.go.id. It can be seen from the graph that West Java and the West Java has a insignificant increase in case, different from East Java and DKI Jakarta and Central Java, which tend to continue to increase. This indicates that the COVID-19 prevention policy in the West Java running optimally, even though the increase in case is not significant. West Java continued to implement the PSBB policy. In the slide is the graph from DKI Jakarta and East Java, and this is a graph from Central Java and West Java. Then move on to the result of coding account using coding personal account from the head regional using NV4 12 plus. In the communication spectrum table of regional head in social media handling COVID-19, it can be seen that all accounts of regional heads still dominate the information spectrum, and some actually have a large percentage. Besides that, the coding result also show that there are similarities in the four accounts of regional heads. Namely, the four are intends to retweet content belonging to the central government, such as the content of Ministry of Health account at Kemenkes RI and the account from the National Disaster Management Agency, BNPB Indonesia. Furthermore, on the spectral consultant, on spectral consult, none of them reach 15%. But in the spectrum, the involved account belonging to Ganjar Pranowo reach 16.25% and Ridwan Kamil's reach 25.75%. In addition, in the collaborative spectrum, both of them also obtain a percentage about 20%. While Anies Baswedan and Kofifa did not reach 5%. In spectrum empowerment, only Ganjar Akon reached 10%. This finding confirms several previous studies that social media is maximally utilized as an effective medium for disseminating information. In addition, it's confirmed that social media is effectively used as a medium of communication and coordination by the government. However, that author criticizes that the ideally is that regional heads should be able to maximum social media and its spectrum so that they can create reciprocity between the great public participation in policymaking. Furthermore, in the table communication model of regional head in social media in handling COVID-19, it can be seen that everything is still focused in one-way communication. But the account of Ganjar Pranowo and Ridwan Kamil had a quite good presentation on the two-way communication and deliberative communication mode. This is because one-way communication doesn't allow for feedback from the public. Supposedly, in the conditions such as a pandemic, must maximize social media as communication. Because in a crisis situation, there is no traditional communication effectively build communication in the real time. The government leads the way. The government leads the way for improvisation in handling on the which is maximizing social media. Indirectly, the coronavirus forced the government to pass talk the challenge related to public health and effective communication. Social media content that present in the relation to the condition of the society, needs, perception, and people used in their to collaborate the government cannot be this can this can be seen in the communication model and the spectrum use tends to be not large. On the other hand, other regions tends to continue to experience and increase. This is also because communication that is built is enable facility condition and occur in the file. Therefore, by communicating intersely on social media, it allows regional heads to influence the social media behavior of the community. One of the most important and effective intervention in the public health response to any event is the proactive communication, what is known, what is not known, and uh, being done to get more information with the aim of saving lives and minimize adverse consequence. Furthermore, the ability the community to move effectively relates to the wish of the community in the COVID it will government and the communicate reliable and relevant information during an emergency to inform people about risks, influence behavior change, and encourage participation in decision making about emergency. The account of regional has still tend to be in the first spectrum, namely information the public. Account belonging to Anies Baswedan and Kofifa Indar still dominate the spectrum of information. However, the accounts belonging to Ganjar Pranowo and Ridwan Kamil have a better percentage on the other spectrum. The communication model used on social media by regional heads tend use one-way communication, but Ridwan Kamil's account also use two-way and deliberative communication, which is quite high. This is based on the social media content presented by Ridwan Kamil, not only focus on the communication spectrum, but the maximizing the spectrum of the communication of other communication. This is effective the handling of COVID-19 in the West Java, which is slowly subsiding. In addition, the communication that Ridwan Kamil built on social media as an effective on the handling COVID-19 in West Java, considering that social media is one of the ideal communication during the COVID-19 pandemic. Therefore, by the communication interestly on the social media, it allows regional heads to influence the social behavior of the community. One of the most important and effective intervention in the public health response to any even the proactively communicate what is known, what is not known, and what is being done to get more information with the aim of saving lives and minimize adverse consequence. That this means that communication by regional heads social media will effective the handling of COVID-19 because it allows regional heads to attract participants and absorb the aspiration of the community through social media. Okay, this enough for our delivery from us. That is all, and we are say thanks to all. Wassalamualaikum warahmatullahi wabarakatuh.